space. As vehicle technology evolves, safety, blah, blah, blah. Yeah, we're going to have to come up with a lot more safety. Pneumonia, signs and symptoms. So you got cough, begins as a dry cough, could produce a thick yellow, green, or blood-tinged mucus. Blood tinged would be bad, really bad. But green, brown, and yellow, that is signs of, I think it's white blood cells. So you're coughing up white blood cells that are fighting the infection in your lungs. So that's good. Well, it's good that it's coming out. It's not good compared to normal. Green is gross. Fever, high body temperature, accompanied by chills and sweating. Shortness of breath, difficulty in breathing, especially during physical activity or exertion. Chest pain, you have a sharp stabbing feeling in your chest. Rapid breathing, increased respiratory rate, also known as tachypnea. Fatigue, feeling excessively tired or weak, and weakness, reduced energy levels, general feeling of malaise. Loss of appetite, don't want to eat or drink anything, that sucks. Confusion to older adults with weakened immune system, pneumonia can cause mental confusion or changes in mental status. Difference between left-sided and right-sided myocardial infarctions. So if you have a left side, this is my heart, it's on the left side. Your left ventricle, left atrium, this is often referred to as just heart attack. So the left side is responsible for pumping oxygenated blood to the body tissue. So everything on this side, your left ventricle, goes to your body. It's going to my pinky, it's going to my eye, it's going to my brain. It goes to the system as a whole, and then it comes back and goes into the right side. Common symptoms of left-sided include chest pain, discomfort can radiate to the left arm, neck, jaw, back. Patients may experience shortness of breath or sweating and nausea. So you're going to see a lot of symptoms immediately happen from the left-sided. I think you get edema too. Right-sided myocardial infarction. Right-sided are less common than left-sided MIs, but still significant clinical implications. So right side receives deoxygenated blood from the body, pumps it to the lungs in order to oxygenate it and make it better. A right-sided MI can affect the body's ability to pump blood to the lungs effectively, and symptoms of a right-sided MI could be fluid retention, such as swelling in the legs, ankles, edema, increased jugular venous pressure, and patients may also have symptoms similar to those of left-sided, such as pain and shortness of breath. Let me catch myself. So left-sided isn't going to cause edema, the right side is. Because your body is trying to pump all that deoxygenated blood back to the heart, where the right side is. And the right side's like, bro, I can't do this right now. So all of that blood is getting backed up, and you'll get edema, swelling in your hands, like little nubs. You'll get it in your feet, your legs probably first. How would the treatments differ? Based on clinical presentation, underlying pathophysiology, both types of heart attack, how do we treat? Reperfusion therapy for left-sided MIs. Crucial to restore blood flow and affected coronary arteries. This can be achieved through their thrombolytic therapy, flow to the affected coronary artery, which can, I just said that, clot-busting medication. So you have thrombolytics such as, what's one, heparin, not Lasix. What is it called? Is it Lasix? Warfarin. Warfarin is a thrombolytic that will bust the clot in order to get your blood pumping in case that it's clotting up. And then you have percutaneous coronary intervention, where a catheter, a needle tip, and a balloon is used to open the blocked artery. And possibly place a stent in order to keep it open. So like, your artery is collapsing on itself because of dead tissue and clots and everything else. You have like this reinforced balloon that blows it up. Now blood's coming through. It has a support. It's a stent. Oxygen medication, oxygen therapy is often administered to improve oxygen supply to the heart. Patients receive medications such as aspirin, nitroglycerin, antiplatelet, that is I just said that was aspirin. Where are we up here? To relieve pain, dilate blood vessels, prevent further clot formation. You also have beta blockers and ACE inhibitors. The heart receives, beta 1 receptors are in the heart. to tell it to do things. You have beta 2 receptors in the lungs. You have 2 lungs, you have 1 heart. You also have an alpha receptor in each. And then the arteries, I think the arteries have both. It doesn't even say what beta. I'd have to research it, but the book didn't tell me. But you have a beta and an alpha in the artery as well. ACE inhibitors, I know this. What is this? Cholinergic enzymes. So you're preventing the cholinergic enzymes. What is it? Arterial cholinergic enzymes? I'm not smart yet. These medications may be used to reduce the heart's workload and improve function after left-sided MI. Monitoring and support. So we have close monitoring of vitals and continuous cardiac monitoring. It's essential to detect any change, promptly supportive care, including pain management, and may be provided. Treatment for right-sided myocardial infarction. So here we go. This is the one that causes edema. This is the one that's going to the lungs. So if we're going to treat it, we want to oxygenate and use medication. Oxygen is a medication. As with left-sided MIs, oxygen therapy and medications such as aspirin, nitroglycerin can be administered to improve blood flow and relieve pain. Do not give nitro if the person is taking Viagra, Cialis, or other vasodilators. Fluid management. Right-sided MIs can lead to fluid retention, so careful fluid management is necessary and may be required to make sure that you prevent fluid overload to maintain hemodynamic stability. Hemodynamic stability is a big word for blood flow, systematic, like the body being in homeostasis because of blood. Homeostasis is a big word for saying all systems go normal. Me right now, I'm in homeostasis. Treatment of right-sided heart failure. If right-sided MI results in heart failure, medications such as diuretics and inotropic agents can be used to improve heart function. So, diuretics is going to make the person pee. It's going to get rid of fluid. And one form of that would be, I think that's Lasix. I'm not sure. It's either lactate ringers or Lasix. I think it's lactate ringers. Monitoring and support. Continue monitoring of vitals and cardiac status is essential, and supportive care is needed. Yep, monitor, make sure normal. Systolic, diastolic, described as phases of the cardiac cycle. So systolic blood pressure, we're going to define that to represent the highest pressure in the arteries during the cardiac cycle. It can occur when the heart contracts, pumps blood out into the arteries. Measurement of systolic blood pressure is the top number. So whenever someone says I have 120 over 80, it's pretty much the perfect BP, perfect blood pressure. The 120 is your systolic. It is the ventricles pumping. Pumping out into the body. And then coming back is your diastolic. So that's the smaller number, 80. Definition of diastolic pressure represents the lowest pressure in the arteries during a cardiac cycle. It occurs when the heart is in a relaxed state, filling the blood for the next contraction. Measurement of diastolic blood pressure is the bottom number. 80 and 120 over 80.